All right, we've got the patient sitting in upright position, checking size, shape, skin color, and vasculature. Presence of any bulging, which could be indication of a fibroadenoma or a cyst, and any dimpling, or it could look like they call it orange peel skin, which can indicate an inflammatory breast cancer, and then checking for edema as well, symmetry while they're sitting up. So then checking also nipple for placement and then drainage, and then noting any discolored or the color of drainage and if there's any odor. So then we're going to screen for retraction, and you have them lift their arms up above their heads and then putting their hands on their hips, squeezing their hands together, contracting the pectoral muscles and leaning forward. So you're checking for retraction of the nipple or areola, which can indicate pulling of any tissue that is inflammatory or malignant. And then now palpating and sitting in an upright position. So first you can start with both hands, using one hand to go under the breast and the other hand to palpate. Just that bottom hand acts as a flat hard surface to feel any nodules with your other top hand. And then when you're having them, or when they're in upright position, you have them flex at the elbow, and you use one of your hands to support their elbow so that they can totally relax their arm. And then you're going to palpate all the way into high axillary region, and down over the chest wall, and then into mid-axillary line, anterior and posterior borders. So anterior border of the axillary and then posterior border, and then that inside part of the upper arm. So we're looking for, feeling for all of the lymph nodes here. So pectoral, which will start down inferior, and then moving up and go central, and then lateral will be slightly outside there. And then subscapular is going to be going farther back posteriorly. And then supraclavicular, infraclavicular, and then you can go ahead and rest your arm down here. So then you have them go into supine position, and we're doing all this, of course, bilaterally. So supine position, you have them put one hand behind their head and they're laying back, resting again there, or relaxing the muscles, and then you're going to palpate in small, gentle concentric circles, making sure that you're hitting all areas of tissue in the breast. So starting on the inside and just going slow and feeling and doing those circles all the way until you get to the outer lateral and medial borders of the breast. And then you go into the vertical strip pattern. So starting up top on that lateral border of the breast, or the talus spence, moving down the lateral border of the breast, palpating. You can start soft, go medium, and then palpate harder in each spot, and then going back up in the line and back over, and then all the way down and up, back down and up, covering all areas until you get to the mid-sternal line, and then you want to be all the way at that post-axillary line when you're starting, or close to that talus spence. So then you can palpate the nipple to check again for any retraction, and then the talus spence going from the breast into that shoulder, kind of that lateral connection, and then again palpating lymph nodes in the supine position. So pectoral, moving up central, lateral lymph nodes, subscapular farther back posteriorly, supraclavicular, and then infraclavicular.